sorry, and caregiver support groups. So with that, if you would like, Rebecca, it's all yours.
Do you want me to take it away, Denise?
Please do.
Good? Okay. All right, everyone. Well, give me 1 second to share my screen. Okay, I'm not seeing it. Let me.
Okay, while you do that, I'm going to just do a quick few housekeeping notes while you get your screen up. So please mute yourself during the presentation. To communicate with the group, use the chat feature and share the chat with the entire group. If you're on the phone, please use unmute, which is 6. And please make sure your name shows on the screen as well as your face. We really are building community, so we'd like to see each other. We appreciate that. And during the case presentation, you can unmute to participate in the discussion as you wish. Just so you're aware, today's session is being recorded, which you saw come up, and be aware that the details of the case have been changed to ensure patient privacy. And that's going to be for after the didactic presentation.
All right. Well, thank you for the introduction. And I'm happy to be here today to present some information. I did just want to say up front that this presentation is a 60-minute presentation, so you'll see me skip over some things. I just want to let you know that because it's a little weird when I have to just like move to the next screen, and that's why I'm doing it, so that I can stay within the time limit. So today what I'm going to do is I'm going to focus on a couple of different things related to Alzheimer's and dementia, specifically the different types of dementia, prevalence of those types of dementia, and some key characteristics, and then move on to talking a little bit about risk factors and what puts people more at risk. And that should really be the bulk of the time that we have today. So I'm going to move forward with the presentation. So you'll see me skip a few slides here. So just bear with me. So the first thing I'm going to do is I'm going to just play a brief video that's going to explain a little bit about Alzheimer's and dementia. This is probably information that many of you are aware of, but the difference between those two terms and the 4 most common types of dementia, and then I'll go into a little bit more detail on some of those, on those dementias and a couple of the other more prevalent dementias.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So that goes into just a little bit about the 4 most common types of dementia. Alzheimer's accounting for about 70 to 80% of all dementia diagnosis. So it's definitely the most common form of dementia. And obviously, you know, we all think of memory loss as the biggest sign or symptom of dementia, but the key being that it is memory loss that is significant enough to disrupt a person's daily life, whether that be because of problems with thinking, judgment, or behavior issues. We're going to talk a little bit about risk factors in a bit, but Approximately 200,000 people are living with what we call younger onset now. It used to be called early onset, but that got confusing and mixed with early stage, people often thought. So now we refer to it as younger onset Alzheimer's disease, which is that is diagnosed prior to the age of 65. And I'm sure most of you know that Alzheimer's is a progressive disease, and so the disease is going to gradually get worse over a number of years, and that is going to depend on each individual person. But there is a lot of research going into treatment right now to hopefully help stop the progression of the disease. So Alzheimer's disease is definitely the most common contributor to dementia. Another one that it talked about was dementia with Lewy bodies, and the video mentioned the protein alpha-synuclein, which actually occurs in the brain naturally, but then when there's problems with that protein found in the brain, it forms Lewy bodies, and that causes changes in the brain. So it is also a progressive dementia that really leads to many similar symptoms as Alzheimer's disease, but also some symptoms that might look a little bit more characteristic of a Lewy body dementia. So it's going to lead to decline in cognition, reasoning, but also some movement changes. You might see movements that are similar to those that you see in people with Parkinson's disease, or you might see more sleep disturbances, for example, in somebody with dementia with Lewy bodies versus someone with Alzheimer's in the beginning stages. One important thing to note is that people who have Down syndrome, probably many of you are aware of what Down syndrome is, but it is a condition in which a person is born with an additional chromosome. And that makes it, they think, more likely that people with Down syndrome are at increased risk of developing Alzheimer's or a dementia that looks very similar to Alzheimer's. So that's an interesting thing that I didn't realize until I started working at the Alzheimer's Association. And frontotemporal dementia was another one of the dementias that is one of the 4 most common types of dementia. But by far, dementia with Lewy bodies and frontotemporal dementia, even though they're part of those 4 most common types of dementia, they're actually a lot more rare than Alzheimer's disease and the second most common type of dementia, which we'll talk about. So frontotemporal dementia, sometimes just called FTD, is actually a group of disorders again, progressive, and causing nerve cell loss in specifically the frontal or temporal lobes, which is obviously where it gets its name. And then there are grouped into 3 different subtypes. So behavior variant frontotemporal dementia, primary progressive aphasia, and disturbances of motor function. One of the things that kind of sets FTD apart from other types of dementia is that most people are actually diagnosed earlier in their 40s, 50s, early 60s, which is actually not when you see most people diagnosed with Alzheimer's disease. So that is something that's a little bit more characteristic of frontotemporal dementia. And frontotemporal dementia also has a little bit more of a genetic component than Alzheimer's disease does. So frontotemporal degeneration is inherited in about 1/3 of all cases. And the genetic component of Alzheimer's disease is actually a lot more rare. I'll talk a little bit more about risk factors if I have time. And then another thing that I wanted to mention too was a lot of times people present when we are serving folks. A lot of times they present with early symptoms that, you know, are like decline in, you know, thinking ability, kind of making poor choices, some short-term memory loss, and they may have been diagnosed with MCI or mild cognitive impairment, but not Alzheimer's disease or another type of dementia. But mild cognitive impairment is actually not a dementia, but Oftentimes I've seen it diagnosed in individuals that I've worked with when the disturbances that they're exhibiting do not meet the threshold for disruption to daily life. So maybe they are seeing some changes, but that disruption to daily life doesn't rise to the level of an Alzheimer's disease diagnosis. People with MCI diagnosis are more likely to develop Alzheimer's or another dementia, but it doesn't always become or lead to a dementia diagnosis. It's also important to know that people can have more than one type of condition that is causing dementia. So mixed dementia is basically what it sounds like when somebody has more than one type of dementia at a time. So most commonly, Alzheimer's disease coexists with vascular dementia, which is, we'll talk about in a minute, but it is most common that those two dementias are combined if someone has more than one type of dementia, but it can also be found in people with dementia with Lewy bodies. And sometimes the person may have brain changes because of other types of dementia as well. So they might be seeing lots of changes in the brain. We know that some of the risk factors that lead to vascular dementia are also risk factors that can lead to Alzheimer's disease. So it makes sense that those two things are often the most common combination of dementias if someone has a mixed dementia. Parkinson's disease dementia is what it sounds like, a decline in thinking and reasoning that develops in people living with Parkinson's. And one of the key criteria for the diagnosis of Parkinson's disease dementia is that the person has been living with Parkinson's disease at least a year after diagnosis. Parkinson's related brain changes spread throughout the brain, similar to Alzheimer's disease, spreads through the brain, and it often, starts to affect those similar types of mental functions that you see with Alzheimer's disease, and that, attention span, thinking, reasoning, judgment, those types of things, but also memory. And I thought this was interesting because it used to be thought that it was more rare, but it's estimated that 50 to 80% of those with Parkinson's disease will eventually develop Parkinson's disease dementia. So dementia related to their Parkinson's disease. One of the other risk factors for developing dementia is traumatic brain injury. So we know that people that are veterans who have served are more at risk of dementia because they're more at risk for traumatic brain injury. So it is obviously, if you know anything about traumatic brain injury, it can affect a person's cognitive abilities in a lot of areas, but learning, thinking, reasoning, and obviously it results from an impact to the head. And over the past 30 years, research has shown that there's a link between traumatic brain injury or repeated concussion, repeated injury to the brain, severe injury to the brain, that leads to a greater risk of developing Alzheimer's or some other type of dementia years and years after the original head injury. So that's something to be aware of. And then lastly, vascular dementia is the second most common type of dementia, and it occurs when there is damage to the brain because of a blood vessel blockage or strokes, and causes symptoms that are similar to Alzheimer's disease, but it sort of happens in a different order, so to speak. So I've initially, usually when someone is experiencing Alzheimer's disease, you'll notice that short-term memory loss is the first thing that you kind of start to notice those changes first. But impaired judgment, impaired ability to reason, to follow directions, to keep a calendar, organized finances, those type of things are more likely to be the initial things that cause frustration or cause somebody to present with an issue with vascular dementia as opposed to memory loss, which is usually the most common symptom that someone first reports with Alzheimer's disease. And vascular dementia is approximately 10% of dementia cases. So really thinking about it, we say it's the second most common, but Alzheimer's disease is by far more common than the other types of dementia. So like I said, 70 to 80% of all dementia is because somebody has Alzheimer's disease. So those are some of course, there's other ones. I didn't go through each one, but it does list some other conditions that can lead to dementia here that if you want to look into, for example, Huntington's disease, but there are other issues as well. And obviously, there are other things that can lead to dementia-like symptoms that, may not really be dementia, but could look like or present like dementia in someone who's older, particularly such as mental illness, like depression or things like that could lead to similar types of symptoms. Medication interactions, drug use, things like that. So the other thing, if I have a few minutes, I actually don't remember what time I started, so I don't really know. I'm going to go with I have a few minutes left.
More than.
And then I'm just going to touch a little bit on risk factors, because I think that's interesting and important to know when we're thinking about who is presenting with Alzheimer's or dementia. I'm going to skip the little quizzes that we have built in here. So the greatest known risk factor for Alzheimer's disease, when we're talking with people, they usually think that it is genetics. When we're just talking to a lay audience, people think it's family history, people think it's genetics, but actually the biggest risk factor for Alzheimer's disease is age. So most people are diagnosed with Alzheimer's disease after the age of 65, but even more so after the age of 85. And it's estimated that about 50 to 60% of people over 85 will develop Alzheimer's disease. So, but there are certain populations that are at higher risk of developing the disease. And so it's important to kind of think about why this might be and what are some of the factors that might put these groups at higher risk, and what can we do to address equity, and some of the research is being devoted to why this is happening. So Hispanics are about 1.5 times as likely as whites to develop Alzheimer's and other dementias. And African Americans are about twice as likely to develop the disease as whites. So those populations are at significantly higher risk, but they're also less likely to be given a diagnosis of Alzheimer's or dementia. So their physician might be less likely to share the diagnosis, or they're less likely to seek out a diagnosis or have access to care to receive a diagnosis. The other important thing to note is that almost 2/3 of Americans with Alzheimer's disease are women. Some of this is attributed to the fact that women live longer than men, and because of that, there are more women in the risk category of age specifically. But there is some research going into other factors why that might be the case. One thing that has been noted is that women who are at the age that puts them at risk for dementia, who are now in that age category, are less likely to have formal education than younger women are. So formal education is actually a protective factor against Alzheimer's or dementia. So that may change as well as more women are getting that more education. And so that might change. But the other thing that's being researched is hormonal factors. And there was some research a few years ago that came out that they think that there might be some factor there with that being a contributing risk factor for women developing Alzheimer's disease at higher rates than men. So with that, I think I have I think I have expired my time. But I don't know if there's any time for any questions or anything, or if you're going to jump right into the presentation, but hopefully that was helpful in talking a little bit about what dementias are the most prevalent that you might see together, and then what populations that we need to pay special attention to when we are providing access to services for families and people affected by the disease.
Now, we do have time for questions. Thank you. That was a very comprehensive in a short time. Thank you. Questions from anyone for Rebecca?
Well, if you think of any, you can let me know as we go on. But yeah.
Yes,
yeah.
Certainly.
Right. All right. Thanks everyone for your time today. Hopefully some of this was helpful. There's a lot more information about Alzheimer's disease and the research that's happening on our website. So if you're interested in, what is some of the research going into treatment right now, there's a lot of exciting research going into the area of risk reduction and what can reduce the risk of developing, which I think is the most exciting, because if we can prevent people from developing Alzheimer's and dementia in the first place, I think that's a great place to start. So our website is just alz.org, and there's tons of information on there about research, but also about caregiving, dementia-related behavioral symptoms, etc. So hopefully that would be a helpful resource as well. So thank you for having me today.